my God, that's so awful. Good evening, everyone. I'm Annemarie Cronin, and I'll be hosting a special live broadcast tonight on News Talk 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here tonight to tell you what you need to know about how to avoid heart attack and stroke altogether, and what you need to do to prevent Alzheimer's and many of the other chronic diseases. If you have a question, we're opening up the lines and taking your calls, so please make a note of this number, 800-859-0957. Again, that number is 800-859-0957. We'll be repeating it throughout the show, and this is your chance to talk directly to the doctor. So stay tuned, and we'll be right back. You're listening to News Talk 760 WJR.
We're on Facebook Live, everybody.
Yes, good. Welcome
Well,
back, Siobhan, over there in
Yes.
Knoxville, Tennessee,
Yeah,
on the
glad to
on
be
the
back.
on the
Tuning in
tour
from the tour bus.
on the tour bus, trying to control the noise.
Yep.
Anyway, welcome to our Facebook Live followers. Hello to South Korea. They'll be glad to know we're back on.
so far.
Yep. I'm
So
just
far,
tuning in to
things
see
are
who's watching here.
all the you're in Knoxville, Tennessee. They're there. We're here in Detroit. So
Thank goodness for technology, right?
yeah, thank goodness for that. So we've got some interesting updates on COVID and treatment and early treatment. Dr. Collender was talking about it on the recorded show that we just did for Sunday afternoon, which is a very good show. If you get a chance to tune in, don't miss it.
That was one of our better shows.
Yeah, actually, it was
I
pretty
don't
good.
say so myself.
If he doesn't say so himself, but I mean, it was actually very informative, I thought, about not going to the hospital.
Well, it's a real problem right now that the best tool to keep you from getting admitted to the hospital is the monoclonal antibody, and the
Beaumont's not
hospitals
doing it.
aren't equipped to offer it in scale. They're
Yeah.
doing 5 or 10 a day when they need to be doing 1,000 a day. And if the system is enabling, I mean Beaumont Health isn't able to provide a critical piece to keep people out of the hospital, something's really wrong. I mean, really wrong. The state should be prepared to do 4,000 of those a day.
Yeah.
Again, I'd like to welcome all of you to our special medical live radio show here on News Talk 760 WJR. I'm Annemarie Cronin, and we are here tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that number is 800-859-0957. Dr. Collender, welcome back. We're still in the time of COVID, and you're just still pushing prevention and how people need to know their status. And the next story that we want to get onto is why you can be treated and you don't need to go to the hospital.
Well, thanks, Anne-Marie. And the most important thing that you need to do as a listener is if you get sick, get tested right away. So disease identification is critical in prevention. So when we're talking about prevention, disease identification means knowing whether or not you have plaque. And if you have plaque, it's not normal. It's not nothing you have to look at next year. It needs to be addressed right then and there. And very critical for COVID, if you get sick, get tested right away. The days of gutting it out, wait a week are over
Right.
because you got
Dr.
a
Collender,
story. Yeah.
Dr. Yeah, go ahead,
not to
Siobhan.
interrupt you, but let me ask you a question. We were talking about this on the bus today with my band, and I was saying this exactly, that you need to get tested right away so you can get treated right away. What are your thoughts on, if you're traveling like us, there are these little test kits that you can buy at CVS or Walgreens. Is there any value to those, or do you need to get like an official rapid test or PCR test?
I think any test that you have is good because especially if you're traveling, they're hard to get. So again, I think it's important to test if you're positive, like you're symptomatic, or you've been in close contact with a positive person. There's a role for testing on a routine basis for kids, that are in school or may not be vaccinated, so they don't have to be. But for adults, having a test kit around so that you can find out right then and there that you have it or not if you're sick and you've been exposed. So I think it's important to test when you're symptomatic, or right away when you're symptomatic.
Even, remotely symptomatic. And for those of you that are listening, my co-host Siobhan is on tour right now with Starsight, weighing in from Knoxville, Tennessee on the bus. That's why she's talking about what do we do if we're touring and we're in a bus? How do we get tested? Very important though, early testing. You've stressed that so many times, but again, I come back to I feel sorry for the patients who they get tested on a Friday night or Saturday morning. They test positive, and then where do they go? And the one place they don't want to go to is the hospital.
Well, unfortunately, if you are admitted to the hospital, that means you have severe COVID, and severe COVID limits your access to all the tools that I use in my practice to keep you out of the hospital. So, the main tool is getting an IV monoclonal antibody therapy. The other things that I do right away is, we've talked about supplements that I use on everybody. We put people on a hydroxychloroquine along with a Z-Pak. We use Pulmicort inhalers or another inhaled corticosteroid, which has been proven helpful in COVID. So all these things happen right away the moment someone calls me that they're positive, and then we work on getting them into an infusion center.
Well, that's your patients. I mean, for the rest of the world, they call their doctor's office and the doctor's office is closed if it's the weekend, Friday night to Monday morning. And they're not doctors, so they don't know whether they're serious or not serious. So, what you're telling me, just so that I understand, if somebody gets sick over the weekend, they can't get a hold of their primary care physician, they should not be going to the hospital. And I really didn't understand that if you go to the hospital, you've got a chance of being rejected there because you're not sick enough. Is that right?
Well, I think the main point we need to stress is that early treatment is critical. And you have an acquaintance, Annemarie, that died from not getting early treatment.
Right.
And so to me, these are not vaccinated, not vaccinated questions. This is a problem of early therapy keeps you out of the hospital regardless of your vaccination status. And this is where the emphasis of our country's power, and the intent should be placed on getting people diagnosed early and treated early instead of, you know, being told to quarantine. Now, yes, you should be quarantined,
Yes.
but you should also be on a program that's going to keep you healthy and out of the hospital. Because again, once you go to the hospital, the treatments that work are not available. You're on supportive care until you pull out of it on your own or you die.
That's pretty pathetic. I think most people don't realize that if people think if they go to the hospital, they're going to be treated. If they get admitted, they are going to be given treatments. And the truth is that they are not going to be given treatments if they go to the hospital. They're going to be put on support to see whether or not they're capable of curing themselves.
Right. Our ICU experts are experts at keeping you alive, but if your body can't do the work on its own, then you're not going to survive that experience. In my mind, the key is early identification and early treatment with everything that's available as an outpatient. You know, the That's what we need to be doing. The whole idea of, throw the kitchen sink at you, whatever it takes to keep you out of the hospital. No one should be looking down on, that kind of approach, because that's the approach I use in prevention. Throw the kitchen sink at everybody, where we're managing all of the possible drivers of chronic disease.
Well, they have to get treated for sure right away. In the meantime, we're going to have to take a short break. Again, you're listening to a special live broadcast. We are here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you would like to talk to the doctor directly about what you need to do to prevent catastrophic disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR. Wow.
That was right to the edge.
Yeah, I know you're you're
Yeah.
burning up my time. I know, right? I'm looking at the clock and
I looked up the clock. It was 27 seconds.
I know, but I mean, it's kind of like I had something to say, so you have to give me
Well,
some
you can
time.
say it now.
But it's too late. I
Well,
mean,
we actually no, we did have a question come in through the Facebook feed.
Yes.
Okay.
Sandy's asking, what about pharmacies' resistance to filling RX prescriptions?
You know, let's come back on that. I mean, I'll try not to get us kicked off the air, but
Don't get us canceled.
right. But no, I'm just going to say that I'm telling my patients to boycott the pharmacies that won't fill their scripts. If they won't fill your script, you can boycott them.
how about the doctor? Let me ask you this question. How about the primary care practice making a list of what pharmacies are going to fill the prescriptions that they're writing? I mean, you can't give somebody a prescription for hydroxychloroquine or whatever and then send them on a wild goose chase going from pharmacy to pharmacy. Don't you
Well-
think that the doctor's office should give you a list of where you can get it filled?
I mean, that's a lot of stuff for me to do.
Not
I mean,
you. I'm talking about the big practices.
well, the big practices aren't treating COVID.
Well, yeah, I
They're
understand
not
that.
treating COVID,
They're not giving
so
you a
they're not
prescription.
engaged at all.
Lovely.
So, Siobhan, feel free to ask that opening up because number one, it opens up the questions, and number two, I'm happy to go there.
Yeah,
Okay,
As
we
I-
did have
as
a
I-
caller come in on
right,
the
good.
actual line too. So do you
Who's-
want to
So
start with
let's-
the caller? Or you
Let's
wanna
do the
start with
caller, and if there's not another caller before that, go to the Facebook
We'll come back.
question.
Okay.
And
I need a few minutes to tell my story. So I mean,
Yeah.
I can't tell it in
You
5
have
seconds.
plenty of segments. Wait until you're ready for segment 4 when you always ask, and then you can tell your story then.
Well, I mean, this is all about getting early treatment and not going to the hospital. So he needs
I'm
the.
kidding. I'm kidding.
He
well, if you
needs
have callers, your story's
No,
gonna have
we're-
to wait.
Well, gee,
callers
thanks.
take-
Who's producing the show here? Like,
Me.
who's the host? No, you're the doctor. You're the expert witness here. Okay. But yeah, okay. So we'll come back to
we don't want
one.
to lose call. We got to keep the caller flow going.
So the caller. I mean, you've got one caller.
Yeah, right now.
Where from?
Richmond.
Virginia.
Can you pronounce that?
I'm not sure if it's
Olivia?
Virginia.
Oh my God.
It could be Michigan. Is there a Richmond, Michigan?
No, I don't think so.
Yeah, there is.
Okay.
There is? Where?
Okay. We've had this caller before, I believe, because I recognize the name, so
Okay.
it might be a regular listener.
She said gross aisle last week. You missed that. Okay, we're back. So just don't forget, this is segment 3, so I need time to tell my story. If you're just now joining us, I'd like to let you know that we're welcoming you to our special live medical radio show here on News Talk 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. He's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. And we're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. And so we'll get right to Siobhan. We already have callers. Siobhan, who's calling?
Yeah, so we have Pat on the line from Richmond. Pat, what's your question?
I was wondering if the doctor has seen the research out of Brazil where they now have realized that some individuals who are lucky and fortunate, they can be exposed to COVID as much as anyone in the world, and they will flag no antibodies and show no symptoms. And it's not called natural immunity, it's called resistance, because they don't show any antibodies, but they don't get the disease. And I was wondering if the doctor has heard about this research.
Well, thanks for calling, Pat. So it's been suspected that about 50% of the population is just not going to get COVID. So it's interesting to see studies coming out now that are supporting that a subset of the population just will never get COVID. And again, it's estimated about 15%. And hopefully more information will come out to guide us. And this underscores the reason we should not be doing mandates when portions of the population have been that are immune and never will be, or just they're resistant, and more data keeps coming out from overseas that if you've been exposed to COVID, your immunity surpasses that of double vaccination. So the idea of, again, I'm all for vaccines in the right situation. I'm highly against this mandate of telling people that everyone should get vaccinated. So there's a lot of information coming out supporting natural immunity again, and I'm happy to hear there's data supporting resistance. Thank you for calling.
Okay, thank you. Siobhan, you have someone that came in through
Yeah, so
Facebook with a question?
we got a question through the Facebook Live that we wanted to address on the air, but Sandy is asking, what about pharmacies resisting filling RX prescriptions?
Well, and I appreciate that call, Sandy. What I tell my patients who I prescribed hydroxychloroquine to, I tell them to leave that pharmacy permanently. And I've thought about having a segment on the show called, Good One, Bad One, where will call out a pharmacy that won't fill our prescriptions for early treatment of COVID, and another one that will for fair balance, and to give our listeners somewhere to go. So feel free to call in and give us our good one, bad ones, and we're happy to alert the listening audience of where to go and where not to go when you need your COVID vaccine, your prescriptions filled.
I asked this last week, and I think it's quite unbelievable that a pharmacist can overrule a doctor's prescription. I mean, this is what you're paid to do, the diagnosis, and your job is to let the patient know what the treatment is going to be for their disease. And then they go out of your office, they go to their local pharmacy, and they can't get the medication. Since when is the pharmacy allowed to overrule what you wrote as a prescription, since you're the treating physician, not them?
Well, so far as I understand it, the Board of Pharmacy has given empowered pharmacists, specifically now, the ability to refuse to fill a prescription for ivermectin. So I'm not even trying, number one, because there's an overall shortage in the country of ivermectin, and I just can't get it filled anywhere. So, I feel like I want to start off the good one, bad one piece. The Walgreens on Northwestern and 12 in Southfield would not fill my hydroxychloroquine prescription for a pharmacy. So, audience, do what you will with that.
No, but I mean, that's pretty ridiculous. It's a shame for the
Yeah.
patient, because the patient comes to see you, they get diagnosed, they don't want to go to the hospital. Now you give them a prescription for medication, because you don't just use one medication, you use a mixture of medications.
We're trying to keep people out of the hospital and alive.
Right.
And that's all we're trying to do. And if we're talking about, you're going to tell a horrific story, Annemarie, you've got a day to start these drugs, because you might go sideways in the next day, and we've lost our window to get you healthy. So it's not a matter of like, oh, I got to drive around and get these scripts. You need them that minute. So when you get delayed and blocked at your neighborhood pharmacy that you've been giving business to your whole life, and now they won't treat you in your greatest time of need, shame on them.
And also the big issue is, since most people are in primary care practices where they're lucky if they can get in to see the doctor. I mean, I don't know how the doctor can diagnose it if they, do telemedicine, but I feel as though there's already an existing barrier of getting in, not to mention, I mean, your patients all have your cell phone number, they can call 24/7 and immediately get to you, and you can tell them what to do and shepherd them from the moment that they think they may have COVID to getting tested, and then also following through with the medications that you put together in order to treat them. But the rest of the world, unfortunately, is thinking that, well, if I'm sick enough and if my fever's high enough, I better just get a ride to the local hospital. And we can't stress enough that that's not the place to go.
Not only is it not a place to go just when you're sick with COVID, I had another circumstance today where my patient called me, has COVID, young guy, diabetic, overweight, someone you might look at and go, I know he's going to be fine if he's listening, but you're going to be fine. But just to the audience, he's someone you'd look at and go, that's someone who's going to have a problem. Overweight, diabetic, doesn't matter how old you are. And I tried to get him a monoclonal antibody therapy. He picked Beaumont Infusion Center in Royal Oak. I could not get him in because they're only doing.
You tried to call several
I
times.
called myself. It took me like 3 times to get through, maybe 4. They're only doing 5 to 10 infusions a day. And this is the flagship hospital of the largest hospital system in our state. They should be doing 1,000 a day. There's 4,000 on average new COVID cases a day. They should all be getting monoclonal antibody therapy at the least, let alone, all right, let's say they're not even getting the hydroxychloroquine. They should be getting or have a shot at getting monoclonal antibody therapy within 3 days.
Well,
And that'll
What's the
keep people out.
limitation? Is it that there's not enough to go around, or what's the reason they're not doing more?
Great question.
Well, they're doing it in the
Great
urgent care.
question.
Go
I
ahead.
mean, why isn't, again, this hospital making the effort to provide this service to the community? Good, why is Pulmicort, which has been reviewed as a drug that reduces complications, respiratory complications in COVID, $1,000 if you have COVID? Because the FDA has not stepped in and made this a priority. So why isn't our neighborhood community hospital making sure that this critical therapy is not available to anyone who needs it? They referred me to Henry Ford.
Wow.
They said, tell your patient, call Henry Ford.
Well, they're also doing it, I mean, in the urgent care centers. So there are urgent care centers out there.
You're
that are
better
handling-
off going to, so we give the infusion center hotline number on the air all the time as our public service. And so, but I'm engaged in with my patients to make sure they're getting to an infusion center that day or the next day, because it can't wait.
Yeah, time is of the essence. So, I mean, it's like we're trying to get the message out there that if you do test positive, don't think that you're going to get in your car and drive to the local hospital. But I'm surprised that Beaumont didn't they're not referring patients out to the local places where they can get.
Why should they? They're the center of
They're in the business
healthcare
of healing people. How
in
about
our
that?
in our right. Why aren't they doing it?
Yeah, I mean, if they don't have the capability, they're not set up to do it, or they don't have enough openings to take the patient.
And that's a major disservice to us in the area, that they're not the focal point on the front line of prevention.
Well, I think at least they should be telling you where you can go, because they're just saying, no, we don't do it. We can't do it. We don't have the capability to do it. So try the next door, go down the street and see if you can. They're not giving a referral. We'll need to come back and talk about that on the other side of the break. Again, you're listening to our special live medical broadcast. If you have a specific question and you would like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Okay, so we're back on Facebook Live. Someone, Sandy piped in to say that the antibody therapy was just made free in Florida. I'm not sure. Is there a cost for it? I mean, I assume there is if you get it.
I'm going to
done here,
find out.
access it.
Well,
Okay.
it's going through insurance, so there's a cost. I don't know what it is, but Florida's funding it. I mean, here's a state that's saying, well, this is what we're going to do. I mean, whatever you want to say about Florida, they're getting it done the right way.
Mhm.
I mean, period. There's no question about it. They're the only ones. I mean, it just goes to show you that mainstream media is making DeSantis in Florida look like a lunatic. And I'm going to say, from a medical point of view, he's the only person doing it the right way in the country.
Yeah.
Out front, get your therapy, stay out of the hospital. That's the right way.
Well,
Yeah.
the other thing though is, don't forget, in Florida, the majority of the people have concierge doctors. So you're able to get to the doctor's handling the treatment, the doctor's, it's 24/7 service. So you get sick on Friday night, you're able to reach your doctor and get started being directed as to where to go.
Well, not everybody in Florida can afford a concierge doctor. I mean, some of them are still seeing hospital-owned practices, and you're talking about the people we know, not the everyday person. Just like the everyday person in Michigan doesn't have a concierge doctor.
Yeah, but any doctors
Yeah,
that
I
I
know,
talk
but
to,
it's
it's not everybody,
yeah,
I
but
agree, but a lot more than what's here, that's for
way
sure.
more, way more. But
yeah.
they're also not pushing vaccination. So that's why they had a little run on COVID not that long ago, and their response was, let's set up early treatment centers, and that was the right response.
All right, I'm sorry, Siobhan, you have callers waiting?
Yeah, but we're
We're
not
not
on
on the
we're on
radio
Facebook
yet.
Live right now.
Oh, okay, fine, we're waiting till we start up again, good.
Right.
Okay.
No, I was gonna say something and now I forgot. Well, I was just gonna comment and say, yeah, Florida at least made it very easy, on the government side for you to access everything. The vaccines, it was very easy to schedule.
Right.
They promoted it, early detection. So, I mean, everyone definitely felt pretty comfortable about what the government was doing to help, at least in the state of
Well,
Florida.
I mean,
Mhm.
they're being portrayed as lunatics on national news, and
Right.
really, they're the only ones doing it the right way. That's how
Pretty sad.
upside down our country is. Really upside down.
Yeah, I was gonna ask a question about early detection. What if you are asymptomatic? Like, how do you know when to test yourself so that it's not too late? You understand what I'm saying? Like, if you're not actually experiencing symptoms,
The
how do you
problem
hop
with
on it early?
the problem with asymptomatic testing, and I think this is a great question for the on the air, is that it's just been discovered or disclosed that vaccinated people are shedding virus all the time. And so if you've been vaccinated and you test, it's a false positive, but they're calling it a case,
Mhm.
so it's really vaccinated people are transmitting more than unvaccinated people, because eventually a vaccinated, unvaccinated person is going to become immune because they got COVID.
Mhm.
Then they're immune. So
Wow.
if you've been vaccinated, there's just no reason to get an asymptomatic test because you're going to have a false positive. Now, if you're
Got it.
sick, get a test and you're positive, right? I'm sick and I'm positive. Get going and get busy getting treated. But, doing nothing when you've been exposed and you're sick is stupid.
Mhm.
But
Mhm.
people don't know that because that's not being talked about on the news.
Yeah. We have 3 callers on the line now.
All
Three now?
right.
So I wanted to know how much time I was gonna have in segment 4, which is probably none.
You got it.
Right, I'll tell you
That's how it rolls.
it was just like they're
You
starting
gotta
to
guess
pile up.
what? You have a live show.
Yeah, I understand I have a live show, fine, whatever. Where's the where? Korea? Gross seal. Oh, it's probably the same person. Welcome back to our special live medical broadcast on News Talk 760 WJR. We're fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about 2 important topics: prevention and being proactive. We're inviting you to call in with your questions at 800-859-0957. Again, that's 800-859-0957. And over the break, we've had a few people lined up. Siobhan, who's on the line?
So let's start with Matt in Grosse Ile. Matt, what's your question?
Yes, hi. First of all, I'd like to just make a quick statement that I agree that I just can't believe that the medical community has done this to the American public and actually maybe the world. It's just astounding to me that they haven't done more to try to keep people well or to find a cure for this. So I applaud you, doctor, for standing up and fighting against this and keeping people alive. It's a huge disservice the medical community has done to us.
Well, thank you.
Yeah, my question is I've been directly exposed to it 4 or 5 times. I don't know if I've had it. Would you recommend getting the antibody testing? Is there any downside to that? And then if I could, one more thing, do you know if there's any correlation to not receiving the flu vaccine? I've never gotten the flu vaccine. I don't I just think my natural immunity to build up is better than relying on a drug to trigger my body. And I wonder if you have any, correlation to not getting the the flu vaccine and then not getting COVID. I wonder if there's any relationship there.
Well, for your first question, don't bother with getting antibody testing. The only reason to get antibody testing is to see if there's no need. If you've gotten COVID and you want to be sure that you have antibodies, then get an antibody test. But if you haven't gotten it for sure, that having antibody test doesn't mean you're not immune, because the immunity is stored in your T cells, and we just don't have a readily available T-score test. As far as the flu shot, I'm really in favor of vaccinations, because vaccines do reduce the inflammation generated by the virus. So there's a lot of data supporting the flu shot reduces your complications of heart attack and stroke if you get it during flu season. I mean, we're questioning, again, I'm questioning the utilization of this vaccine for all kinds of reasons. But in general, I'm pro-vaccine. So everyone should get a flu shot.
Okay, Siobhan, who's your
Yeah.
caller?
Up next, we have Linda in Southfield. Linda, what's your question?
Good evening, good doctor. So, unfortunately, I had the experience of having COVID, but being lucky enough to get in at Beaumont. And I must say that the staff did a wonderful job. Myself and my son both had COVID. And while I got in, he did not. But we were given resources on where else to go. So I'm sorry that that was your experience today, that they did give us 3 other places to go, and we ended up getting in at another location. However, the nursing staff went above and beyond. So I'm very sorry that that's your experience, but please don't misinform people just based on your experience.
Well, thank you for calling. I'm glad you're doing well, but letting people know that they're only doing 5 to 10 infusions a day is not misinformation. That's the fact. And them being who they are, they should be doing a lot more infusions. And that's also an expectation that the community has of them. So this is not misinformation. This is telling people that if they get sick, that may not be the place to go, because they're not set up for volume when you have a day or two to respond. So that's not misinformation. Thank you for calling.
Yeah, it is. I mean, it's too bad that they're not set up, but I think, as I said before in the last segment or over the break, they ought to be giving out referrals of places to go that can uh, perform the monoclonal antibody treatments and other treatments. Siobhan, do you have another caller?
Yeah, we have 2 more actually. So up next, we have David in Windsor. David, what's your question?
Yes, my question for the doctor is this with regards to vaccine mandates in order for people to continue to work at their jobs or anywhere else, or go to any fitness center like a swimming facility or anything like that. What are the likelihood of people resisting it because of being forced to get vaccinated in order to continue going to the places that I've mentioned? On top of that, how many medical doctors these days stress or emphasize more about nutrition and nourishing the body rather than vaccinating it?
Well, thanks for calling. As far as what should people do? Will there be resistance? I can't speculate what people will do. We're not advocating, resistance in that way. I would like to hope that the medical community will wake up and recognize that this vaccine isn't for everybody, that people that are resistant, as per our previous caller, probably don't need to be vaccinated. People that have been recovered from COVID, like this previous caller, don't need vaccination, because there's study after study demonstrating natural immunity is better than the protection from, and I use that word carefully, protection from the vaccines. So, how many doctors are practicing prevention? Very few. And that's why we're on the air educating people about what to do, where to go, and how to how to save your life when it needs to be.
And why you need to know your profile. You need to find out what your profile is, and
Right.
exactly,
It's
people need to know what role inflammation plays
it's
in
not
getting
just
sick.
about It's not just about diet. It's about learning where disease identification. Do you have plaque? What's the status of your plaque? What's the level of your inflammation? What's your CIMT number? The most important number to know for your health. That's what you need to know so you know how to respond.
Absolutely. Siobhan, do you have another caller?
Yep, we have 2 so far more. Up next we have Dennis in Brockwood. Dennis, what's your question?
Are you with us, Dennis? Can you hear us? Are you with us? Well, let's come back to him if he's not connected.
Yeah, I'm
Who
not
else
sure.
do you
Maybe
have?
he's not on the line. Okay, so we have Dan in Macomb then. Dan, what's your question?
Hi, thanks for taking my call. You're doing a great service, Doctor. The local community appreciate it.
Well, thank you.
You may have answered this question before in prior shows and maybe even the current show. If you've had the 3 vaccinations, I have Pfizer like you have, I think.
Yeah.
Is there a way of measuring the degree of protection you have or not by some test that's available somewhere?
Well, we already know that the vaccines have a half-life, and I don't know that I should be using the word vaccine anymore. Because I don't like to prescribe medications with long half-lives. I prefer prescriptions that have shorter half-lives. Like for instance, I don't like using drugs for osteoporosis because they have long half-lives, and I wouldn't think to give my wife a drug that has a half-life of years in your system. And I don't necessarily like the idea of using a drug that has a half-life of 5 to 8 months. So after the half-life of this treatment goes away, then you probably aren't immune anymore. So we're basing this information on what's happening in Israel, where there's a lot of reinfection toward the end of the activity of this treatment.
So is there a test that will measure the degree of protection you have or not?
Well, right
It's
now they're
readily
they're basing it on your antibody level. So so if you've been vaccinated, the antibody level is probably a gauge of whether it's working or not. If you've had COVID, the antibody level is like, all right, you're for sure immune, if it's positive, but you're probably still have natural immunity for a long time afterward. And not probably, you do.
Well, that's good to know. Siobhan, do you have that other caller on the line?
We have another
Dennis?
caller back. I think how much do we
We
have
have a
enough time
break.
left to-
Well,
Yeah.
we'll have to come back on the other and take the call on the other side of the break. In the meantime, you are listening to a special live broadcast from the studios of Startup Nation in downtown Birmingham. If you have a specific question on the subject we're discussing tonight and you'd like to talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR. So, I mean, how many more do you have? You got anybody else waiting?
So we the one caller that wasn't there is back, so we can get him on the
Dennis?
other side of the break. Yeah.
Okay,
So
so
am I in trouble?
why are you in trouble?
Oh,
What'd you
never
say?
mind. This caller's gone. So
Well,
right.
We have no callers.
It's like Sue.
so we have no.
What? No,
Just like Sue.
we have
She's
no
there and she's gone. She's there and she's gone.
we have no trouble. We have no trouble. But I'm down to segment 5, and I have to remember when I come back to talk about the Sunday show.
Okay.
So
We also did you really tell your story? Did you?
I'm trying to,
reference it?
but
Well,
you see,
so start. We don't have callers.
no,
so
I
start with
gave
that.
up. I gave up the first segment, and that was a big mistake.
Well, it's good. You got
you get
calls,
bumped.
So
No, we did. I don't know. We got like what 6 or 7 calls.
yeah,
We had
we're
a
back
good
at
run.
48.
Whole
Yeah, you did.
segment. We got probably 10 calls anyway.
Yeah, there was a lot.
Yeah,
lot.
well, I refer to the vaccine as a treatment. That's how I'm referring to it now.
I know, but I'm not too sure. I felt like stopping you there because people don't understand. Unfortunately, they don't understand your sense of humor. I mean, it's like
Right.
It's like they don't. When people call it a jag and a shot.
I know,
and
but
this
the
and a that.
listen, they get what I'm saying. They're reading between the lines.
Yeah, that's because
the listeners are listening.
You have a mostly intelligent, educated
Right.
population.
They're
Some
listening
of the
and
time.
Oh, we
can
got
tell.
callers back.
Oh,
So we have
how many callers do you have?
2 so
No
far.
disrespect to your friend,
From where?
Olivia.
Ray Township and New Boston.
Okay. So am I taking the callers first?
I would.
I guess. Yeah, I can't wait because I mean, basically, I don't know. We'll have to do another show this week, I guess, and I get the
You'll
whole
probably get
show.
your story in.
No, I probably won't because it's a shorter segment. It doesn't matter. And then once we're talking, we'll have other callers. Anyway, it doesn't matter. I mean, we can still talk about this next week because it'll still be an issue next week.
Yep.
It's not like it's going away.
Right. Right.
Ugh. Final segment.
I
It's
mean,
nice how everybody pays homage to you, though. That's
that's how it should be.
yeah, right. I'm gonna bring a crown for you. I'm gonna bring a crown for you next week, so you'll just have your little crown over there.
I'm finally being treated the way I should.
You and Brock have a lot in common.
We'll get you a ring for your thumb. So that's only worn by the king in royalty when you've got a big
With
ring
my
in your thumb.
stamp.
Right, exactly. That's it. So get him a crown and a big ring for his thumb. Yeah. Anyway, when are we back? Actually, right now. Yeah, right. Crown Royal.
Yeah.
Mark
We're
piping
back
in.
at 48.
There's 48
less
right
than a
now,
minute.
so we don't
No,
have too
it's
much.
No, that clock is probably ahead. It's 47. and some.
Oh, I see. I never know which clock it is. Anyway, this is
I'm
it.
hearing a phone. Yeah, you gotta please take it.
Yeah,
Olivia.
turn it off. Don't have your phone on. Turn it on
And-
silent.
I know, but it's,
Yeah, but
it's
no, you should turn
vibrating.
it's vibrating. Yeah, we can hear
we
it.
hear it on the microphone actually.
Yeah.
And stop mispronouncing cities wrong.
Mispronouncing cities wrong. She's not didn't take any calls. Ah, too funny. Yeah, that was actually humorous. It was added a little bit of humor to the show. You got the attorneys are advertising. That's nice. Welcome back to the final segment of our special live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat the chronic and debilitating diseases we've come to accept as inevitable. You are listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention. If you have a question for the doctor, now is your chance to call at 800-859-0957. Again, that's 800-859-0957. And before we go back to the callers, I'd just like the listeners to know, please tune in to the Sunday shows. Every Sunday, Dr. Kolender is on at 3 p.m. And it's not a live show, but a lot of information on the Sunday show, as well as keep tuning in to the Thursday night live show at 7 p.m. Dr. Kolender, well, I guess we've got callers. We've got callers waiting. Should we, Siobhan, who do you have?
Callers.
Go ahead.
So first up, we have Dave in Ray Township. Dave, what's your question?
Yes, thank you, doctor, for your service. Listen to your program all the time. It's not COVID related. I'm 73. At 63, I had a little bit of rash on the top of my head, and the doctor said that it was shingles. Gave me some medication. It went away. I recently went to the skin doctor. He said, I asked him, what do you think I should do? Should I get the shingles shot? I heard that if you've had shingles once, it's unlikely that you'll get it again. But then I've read some things that said that's not the case. What would you suggest?
I recommend my patients get the shingles vaccine, whether or not they've had shingles before. So if you did have shingles or not, and you had chicken pox as a child, you should definitely get the vaccine, because the older you are, your immune system goes down. The inflammation from the shingles the virus can be more severe and actually trigger a vascular event like a heart attack or stroke. So absolutely, I recommend getting vaccinated. If your doctor says you're a candidate, get vaccinated.
All right, Siobhan.
Okay, up next we have Chris in New Boston. Chris, what's your question?
Hi, good afternoon, doctor. Thank you so much for all the information. With what you were saying about natural immunity being better, that struck my thinking. My wife and I both think we may have had COVID before we got the vaccine. So I know an antibody test, from what I researched, this is what I want to make sure with you. It looks like an antibody test wouldn't help because that would show from the vaccine, but we heard the nucleocapsid test would. So I just want to know if that's true. And if so, where do you think I could get one of those?
The real test is for getting T cells, and this is, I would look at it as an experimental research type blood test, and I'm not aware of any place that looks at um, T cell immunity for COVID or for any other disease. It's more of a research lab test. So, um, if you for sure had COVID, if you're not sure you had COVID, unfortunately, there's just no way to know. And I don't know I don't think that nucleocapsid test is helpful.
Okay, thank you for
Okay,
calling, Siobhan. We have another caller.
yeah, we have a couple more. So we have Marilee and Holly. Marilee, what's your question?
Hi, thank you. I'm kind of blown away by the stance that Dr. Kolender is taking. It's great. It's great information. He's talking a lot about people with pre-existing conditions and rapidly getting tested. What about the age groups like the millennials, that age group, like my kids, or that haven't had it?
Well, so this
He
is
said not everybody should get vaccinated.
yeah, well, this is where I'm getting dirty looks from across the table right now to keep my medical license and keep us on the air. So
Absolutely.
yeah,
Yep.
so the risk of people under 30 of having a serious complication from COVID is lower. And there is, on the label of Comirnaty and now Moderna, Comirnaty is the approved version of the Pfizer vaccine. Those have labels for myocarditis. So, should everyone get a vaccine where there's a risk of a possibly serious complication? I don't, my feeling is no. And the risk of the individual should be weighed in, and not just the risk of a complication from COVID, but the risk of having, a vaccine injury. So, I don't believe in mandates. We're a personalized healthcare practice. Prevention is done on a one-to-one basis, and I feel all treatment should be done on a one-to-one basis. And a blanket statement does not work for anybody.
So before we go back to other callers, I just want to jump in here because as I'm listening to this caller, I think it's incumbent upon all the listeners to realize that they need to get hooked up with, join, or be part of a type of practice like yours that specializes in prevention and profiling of where you stand. And should you get sick with COVID, instead of worrying about what shot should I get the booster, I'm vaccinated, I'm not vaccinated. If you get the disease and you're not going to be treated in the hospital, they need to have a doctor, a primary care doctor, to shepherd them through the process and give them the medication they need. That's the most important, answer to these callers is they absolutely have to have a reliable primary care physician so that, like you've said before, the minute you get diagnosed, the minute you test positive, you need to jump on that immediately in order to save your life or to give you a better chance.
And listeners need to have this planned out ahead of time. You can't wait for, oh, I'm sick, got a positive
No.
test. What do I do? You need to know, is your pharmacy going to fill your script? Is your doctor going to write a script? And where do I go to get an infusion? You need to know all this stuff ahead of time because you might go to your local giant hospital and guess what? They're not doing enough of them for you to get in.
And if you can't find a doctor, then call 866 Kolender. That's 866 KOLENDER. And Dr. Colender's office will be glad to point you in the right direction because I know a lot of you have insufficient medical care and certainly insufficient access to primary care and doctors in general during this time. I'm getting signals from Siobhan in Knoxville that we've got two callers waiting and we're almost at the end of
Yeah,
the
so
show.
let's try and
Siobhan.
get them in. So we have first Jim in Birmingham. Jim, what's your question?
Hi, yes, good evening. I, in retrospect, had COVID last Thanksgiving. I had the antibody test this summer as part of my physical. Because of my travel schedule, I have since gone ahead and been vaccinated, although I probably would have preferred not to. I guess, I had very mild symptoms when I did have it. Is there any data, or what are your thoughts as far as already have the natural antibodies and then going ahead with the vaccine?
Well, I'm gonna cut you off because we're running out of time. But unfortunately, you may have blunted your immunity by getting vaccinated after having COVID.
Okay, let's move
Wow.
on. One last caller. Can we squeeze them
Okay,
in?
yeah,
Where from?
let's squeeze them in. We have Mark in Pleasant Ridge. Mark, you have just a few seconds if you can fit your question in.
Hello.
Hi, Mark. What's your question?
Hi, Mark. What's your question?
Hi, good evening. I just had, I'm listening to everything, and I really like all the information that's being put out there. I feel like a lot of this doesn't really hit, what mainstream is. I had COVID.
Mark, you
I
got to ask
recovered
the
from
question.
COVID.
We're out of time.
What is
What's
your question?
My question is the vaccine in fact FDA approved vaccine, or is it only approved for emergency use? That's one part. And the second part is, do you believe that they're actually reporting the negative effects of the vaccine accurately?
It's too loaded of an answer. That's a whole other show,
call us back
unfortunately.
next week, please. Good
call
question.
us back next week.
Call us
Yes,
back next week.
absolutely. Unfortunately, we're out of time, so I'd like to quickly thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, Annemarie Cronin. I'd also like to thank my co-host, Siobhan, weighing in from Knoxville, Tennessee. We hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Please continue to tune in to our shows Sunday at 3 p.m., Thursday live at 7 p.m. for the latest medical updates. And thank you for listening to News Talk 760 WJR. Good night and be well.
What's all